So kidney cancer has actually been on the rise, sort of similar to kidney disease, multiply too quickly and sort of out of control. So our body doesn't, I guess a little bit similar to kidney disease, symptoms.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am joined again by the amazing and wonderful Emily Carhill. Emily, thank you for joining us. Let's start with that of just the pathophysiology of the disease and what kidney cancer actually looks like versus chronic kidney disease.
Sure. So kidney cancer has actually been on the rise, sort of similar to kidney disease. Sort of since the 1970s, the incidence of kidney cancer has been increasing, which may partly be because we are better at picking it up, but also because a lot of the risk factors are, sort of, I guess, lifestyle type things as well. So, I guess going back to what cancer is. So cancer's when cells in the body have become abnormal for some reason and they start to grow and multiply too quickly and sort of out of control. So our body doesn't have the same checks and balances that it usually would have to keep control of these cells. And they also don't act on their own. So cancer cells also enlist, our other body cells, genes and proteins and things like that in the body to help them to continue to grow and divide. So it's, I guess, a little bit similar to kidney disease. Symptoms or signs of symptoms of kidney cancer don't often come up until the cancer is sort of a little bit larger and a bit sort of further along because some of them are quite vague. And they're also actually quite similar, to signs and symptoms of kidney disease. So things like having blood in your urine, having pain on your back, sort of on one side. Sometimes people can get a sort of a bit of a mass or a lump on one side of their back, loss of weight, loss of appetite, fever. That one's obviously different from kidney disease, and anemia. So I'll often see that people are diagnosed with kidney cancer often actually when they're getting investigations into something completely different. So they've got something else going on and they've had a scan and it's been picked up then, rather than, having signs and symptoms and going in and sort of getting those investigated.
Yeah, that's so very true, isn't it? With cancers in general, not often, but they can be one of those things that get picked up as a anomaly for other things. And I definitely know that's the case with kidney cancer, because I guess a lot of people aren't thinking kidney cancer with those sort of, and they're quite vague symptoms really, a little bit of lower back pain, unless you've got the blood in the urine. The rest could just be, oh, I've got a bit of a fever, I'm a bit fluey, I'm just a bit achy. I guess no one's going to be thinking of kidney cancer. So of all the cancers, where does kidney cancer rank as far as, how popular is the wrong word, but how common it is? So I guess breast cancer and those sort of things sit right up the top. Where does kidney cancer sit on that list of cancers?
Yeah, it's definitely, it's not one of the, I guess, more common cancers, breast cancer, prostate cancer, lung cancer, which is sort of becoming more common, are all certainly more common. I don't know exactly where it sits in sort of prevalence, but yeah, it is certainly further down, but does seem to be becoming more common.
Okay. And why do you, and I know you mentioned lifestyle, do you think it's the lifestyle factors that are making kidney cancer more common? Do you think it's an environmental issue?
Yeah, I think definitely partly environmental. I guess the thing we've got to remember with the kidneys is that they're the filtering units of the body. So anything that goes through our body, any toxins we're exposed to, have to be filtered through the kidneys. And that is, some of the risk factors for kidney cancer is being exposed to toxins or industrial byproducts or even asbestos. So I think partly that, but also the thing that increases the risk the most is smoking. So smoking actually doubles your risk of developing kidney cancer. And again, it's, filtering the toxins in cigarettes through the body.
So thank you, Emily. I really appreciate your expertise in this area. And make sure you hit subscribe. If you want more information about who we are at Kidney Coach, head over to www.kidneycoach.com. So until next time, make sure you subscribe, give us a like if you like this information, and if there's any specific topics you want to know, make sure you add it in the comments below. All right, have a wonderful day, Emily. Thank you, and we'll talk to you next time. Bye.